Well, hello, friends and family. Here we are again on night 2 of video. I wanted to just make a follow-up video because I got a lot of response from the video I posted last night. And I wanted to answer some questions and also just add a few things that I forgot that I feel like are important. I didn't say last night. So just wanted to start off by saying thanks for letting me come into your homes and to tell you a little bit about what we're doing and why we're doing it. Just felt grateful. My heart in making the video yesterday and today is just wanting to, I just had this feeling of wanting to be able to talk to all my loved ones and friends and family and kind of explain the importance of what's going on currently in our nation and in the world, and the decisions that leaders are making and so forth. So, I just wanted to be able to talk to everyone, and obviously I can't. And so that was kind of my heart in sharing with you. So I wanted to just go through some stuff that I didn't share last night. Sorry, my videos. I'm obviously not a professional video person. Also not an expert on coronavirus. I am an ER nurse, and I have read studies and looked for good information online and then gone from there. So, yeah. So one of the main things that I've heard in the last few days of why do we actually need to socially distance? Why do we need to do life so differently here for the next few weeks? Because there's only a few cases in my area. There's only a few positives. I haven't looked today, but the last that I saw from Tulare County was that we had 3 confirmed positive cases. And for the last few days, I've been just telling people that, the likelihood is that the virus is spreading fast and that there's a lot of people in our community that are already affected or infected. And the reason we don't see that yet in positive tests, there's several reasons. There's been problems with testing. I don't know what it is, but maybe limited tests. I haven't done a lot of research into it, but our health departments were limiting the people that were tested for a long time. And so that's one of the limiting factors. The other thing, like I explained in last night's video, is that people usually don't show signs or symptoms of being infected for average of 5 days after they come in contact with the virus, whether that be through a contaminated surface or being with a sick person in a common area or whatever. So there's it's a 2 to 14 day incubation period, but most people start showing signs around 5 days. And then also, like I said last night, most patients don't feel the need to seek medical attention until day 5 through 7 of the illness. And so I think we have a lot of people here in Tulare County that are infected and are in the community, but either their illness is mild and so they haven't needed to seek medical attention, or they're early enough on in their illness that they haven't needed to seek medical attention, or they have sought medical attention, but we've had limits on testing that I think are getting lifted. It's just the reality of how things are with tests and whatever has gone on in the country. No one to I don't have anyone to blame. I'm not mad about it, but and so we haven't tested them. Those are my personal opinions on that one. So I think that we have a lot of people in our communities that are infected. We just don't have the test results. The other thing is that when people are tested, it takes between 2 to 7 days to get the test results back. So even though we've gotten, like, we've been testing more people, larger amounts of people, we haven't gotten those test results back necessarily yet. So, and obviously this is just vague and I can't speak to certain situations, but just on a general view of why our numbers are low, I don't think they're actually that low. So just keep that in mind. If you choose not to be socially distancing and you're out and about, and even if you're just out and about to do groceries, don't be thinking in your mind, oh, there's only 4 people in this community that can infect me, or 3 people, or whatever it is. Anytime I go out currently, I'm just like on alert that there is very likely infection all around me. So that's one thought on that. And then a lot of people reached out to me today with different questions. And so the first one that I want to talk about was our kids. Obviously, as a mom of 3 little kids, and I just resonated with this. That I had several other moms reach out to me like, hey, I'm just really concerned about my kids. And so they are at risk for getting infected. But thank the Lord, they have a lot, like, in general, they are having a lot less critical of an illness. And there are still some cases of kids getting really sick and needing respiratory support, needing to be intubated. And so it's always possible, but just want to encourage your heart as a mom that, like, there's a lot of uncertainty in the world currently, but just take heart. That's a gift with this pandemic, is that it's not attacking our kids as much. Now, that being said, kids are getting infected just as much, and so they're spreading it just as much, if not more, but their illnesses are not as hard. And sometimes they've found, in the studies, they've found that kids are, like, have positive infections when they swab their noses, but they're having no signs and symptoms. So, which means they can be spreading the illness without signs and symptoms. So that's one thought. But yeah, just be encouraged, moms. Let's see. Another question I got, or another thing I wanted to talk about, was the signs and symptoms. I posted today on my Instagram account just a list of signs and symptoms on the CDC site, and you've probably seen lots of it because it's everywhere. But there's like the 3 symptoms: cough, fever, and shortness of breath. And though those are like the most common symptoms, I think we need to be aware that there are lots of other symptoms. In the studies that I talked about yesterday, I read from China, they included all of these. So I will read through them. Cough, shortness of breath, fever, which are more on the shortness of breath and fever. Shortness of breath is usually more on the back end with the pneumonia. Fatigue, body aches, headache, dizziness, abdominal pain, nausea, vomiting, diarrhea, lack of appetite, confusion, consistent pain or pressure in your chest. And so to me, that's just a huge, like, amount of all different kinds of symptoms. Some people in China were displaying, and especially in kids, they were seeing kids who were only having nausea, vomiting, and diarrhea, or only diarrhea, no fever, but positive infection. So at this state, like in our current situation, my advice is just, hey, if you have any inkling that you have any sickness at all, stay home. And stay home for days after you get better. Just not worth it putting other people at risk. There are several important signs and symptoms to be aware of. And if you scroll down on the CDC site, you can see these, but these are emergency symptoms which you need to seek medical care right away for. So if you or someone in your family starts having these symptoms, you need to seek medical care. Shortness of breath, which is a feeling of like not getting enough air. You can't get enough air. A bluish discoloration of the lips or face. A new confusion or someone being difficult to arouse. And consistent pain or pressure in your chest. Those are all signs of like the later pneumonia, that your lungs are not working at the capacity that they should, and you need to come to the hospital. So if you are having the other signs and symptoms, or your kids are, or someone in your family is, you don't necessarily need to seek medical care, which you've probably heard, but also you don't necessarily need to even be tested. Like, being tested doesn't change our treatment, because we don't currently like have a antiviral that specifically targets coronavirus, or an antibiotic of some sort. I guess I could say, yeah, if you have other signs and symptoms of a viral illness, you don't necessarily need to seek medical attention. It's good to just take care of yourself like you would with another viral illness, or take care of your family member. One of the main ways that it's transmitted in the early infection, like when people start coughing, they are coughing out the virus. And so then they're coughing on surfaces, they're coughing at their family member, they're coughing at you at Costco or Save Mart or whatever. So they're spreading illness that way. But before that, they can be spreading the virus through like oral or fecal contamination. So some kid is like licking the cart at Costco, which is very possible. They're infected. They have no idea because they have no symptoms. And then 15 minutes later, you're pushing that cart around, and then you're picking your fingernail or whatever. So you can contract the virus through other ways of contact, not just people coughing at you. So that's why it's so important. The hand hygiene is so important. Don't touch your face is important. Don't touch anything that any of your mucous membranes where you can take that infection from your hands that you've picked up somewhere else and put it in your body. So that's that. Oh, the other one, one more sign and symptom I forgot to add to my list was the sore throat. And in most cases, the sore throat was not accompanied by like a runny nose, but it was in some cases. So it's like with any virus, it's like everybody's body responds differently. And so you may have different symptoms. You might have a totally different experience than your husband or your kids or your roommate or whoever having the same virus. So that's why I say if you have anything in you doesn't feel good, just take extra precaution to stay home. Wash your hands all the time. Disinfect your surfaces. If your kids are sick, they spread viruses so easily because they aren't aware of, coughing in certain ways, or getting their secretions on different things, or how well they wash their hands after they go to the bathroom, or not touching the toilet or whatever. So I would just recommend that if you or someone in your family does develop symptoms, first off, don't freak out. Like, there's going to be a lot of us in our communities that over the next however many months, who knows how long this will go on, but will develop the illness, because at some point, the social distancing will ease. We'll have to get back to like everyday life. People will still be getting the infection. It will be spread out more. So anyways, all I'm saying is there's going to be lots of people who get sick at some point. We just want to like spread out we just want to slow the spread. And, the longer we slow the spread, the more we can learn in medicine of how to take care of people well. And so on. So don't freak out if you start having signs of like a viral illness, or you start having any of these symptoms that I've said. It's okay. It very well could be coronavirus. It could also very easily be some other virus, or it could be your allergies. But the best is just to assume the worst in this scenario so that you can take care of yourself and those around you in the best way. Testing. I don't think I talked about testing. So, I mentioned it. Testing doesn't change our treatment, so there's no real need to get tested. We're testing people in the hospitals, and the State Department is testing people. Testing is going on. It's part of how they monitor illness, and it's part of how they educate people on how to quarantine themselves. So it's important in that sense, but there's no like medical reason you actually need to be tested. And by being tested, you're, in some way, they're trying to limit the exposure to other people, but you're going to have to be exposed to someone else in the way that you're tested. So I would follow like your closest hospital. I would follow them on Instagram. All of them are putting out updates on how testing is happening and where to get tested, how to get tested. The best thing is to not go to the ER unless you're having the emergent signs and symptoms where your lips are blue, your face is blue, you're very short of breath, someone's confused, you can't wake them up, or you're having severe chest pain. Those are reasons you can go to the ER. But if you do have to go to the ER, we just ask that you put a mask on before you come in. And if you don't have a mask until you come in, just covering your mouth in some way. Because our ERs are full of our most vulnerable population, right? They are usually full of elderly people who have chronic conditions. And so as a health system, that's one of our concerns, is protecting our patients who are also the high risk. They're high risk for the worst possible case of COVID-19, of, just the death from their lungs shutting down. But they're also the ones who are needing our continued care. And so, sorry this video is getting long. I didn't think it'd be longer than last night, but it is. Let's see. So if someone gets it, don't freak out. Stay home and take care of them like you would a normal virus. And just really good hand washing and sanitize surfaces in your home, all that stuff. I think the last thing that I wanted to say was just like, take care of yourselves. Just on my heart, the last 24 hours has been like all the people around us and ourselves that struggle with anxiety in general. I just have had a space in my heart that's been like, man, this is probably so exacerbating for people who struggle with anxiety and have to battle it in general. This is like just a way that it can sneak in and take over. So just want to encourage you to take care of yourself, do some good self-care. I'm sure there's some good resources online right now for what that looks like. And yeah, if there's other stuff that comes up, I will maybe make another video. I don't know. We'll see. But just wanted to say I'm proud of you guys for making the sacrifices you're making, even if they're not for yourself. The sacrifices you're making for your community and those around you. And also just want to say thanks on behalf of the medical community. I feel honored to be a part of the medical community right now, but also just feel a constant like outpouring of love from the community towards us in medicine and first responders and such. So I hope you guys are having a good rest of your week, and always love to answer questions or help explain things that are out there that aren't as clear as they should be. And but if I don't get back to you for a few days, I've got 3 little kids at home that I homeschool, and I get to do ER nursing on the side. So that's probably why. But love you all. Blessings to you. And thanks for listening. Bye.